I've got 1 o'clock now, so if everyone's here, I think we could get going.
Right.
Okay. Yeah. So, so I'd like to say hello, and I'd like to welcome everyone this afternoon to this afternoon's session. My name is Kathy Waite, and I volunteer for CARP in Regina. I live just outside of Regina, actually. We're all talking about weather and scenery, and I'm very lucky I can see the Capel Valley from my bedroom window.
Lovely.
So in a moment, we're going to be hearing from Kathleen Spat. She's the president of CARP in Regina, and then the panelists that you can all see. There's Shan Landry, Brian Martin, and Bill Van Gorder. So we expect to go for around an hour, but we will run over if there's lots of good, really good questions. At the bottom of your screen, you can probably see chat and then questions and answers. If you could please type your questions into the Q&A, not into the chat, then as we go along, I'm going to collect all the questions up and I'll ask them at the end of the presentations. So this is being recorded, and hopefully we'll share a link later on social media for people who couldn't get here, or if you enjoy it and you want to share it with a friend, that would be great. So for now, I'm going to hand over to Kathleen.
Hi, everyone. As Kathy said, I'm Kathleen Spat. For those who may be unfamiliar with who CARP is Canada's largest advocacy organization for older adults with over 320,000 members across the country. As a nonprofit, nonpartisan association, we advocate to uphold the rights and improve the lives of Canadians as we age. Our chapter is located in Regina, but as we are right now, the only chapter in Saskatchewan, we also advocate on behalf of all older adults across the province. So welcome to the second in a series of 3 town halls, which are focusing on the critical issues of seniors advocate, long-term care, and vaccinations for older adults. Today's session is on long-term care reform. It gives me great pleasure to introduce our panelists today and read their biographies. Shan Landry has had a long career in healthcare, first as a social worker and then as a senior administrator. Shan has worked towards promoting the basic determinants of health and connecting traditional healthcare services to a wider role in improving community well-being. Shan retired from the health region in 2012 after being responsible for most of the non-acute community health services, including long-term care, home care, primary health care, public health and health promotion, mental health and addictions. She is co-chair of the Prairie Hospice Society Board, past chair of the Saskatoon Council on Aging, member of the Age-Friendly Community Development Committee, board member of Saskatchewan Seniors Mechanism, and a founding member of the newly forming Saskatchewan Long-Term Care Network. Welcome, Shan.
Thank you.
Brian Martin, our next panelist is Brian Martin. He was born and raised in Saskatchewan. He has worked in a leadership role in special care homes the majority of his career, and has just recently retired from Mont St. Joseph Special Care Home in Prince Albert, where they have been actively encouraging government to commit to a strategic, collaborative process to improve the planning and provision of long-term care in our province. So we can look forward to hearing from Brian as well. Welcome, Brian.
Thank you.
And then finally, we have Bill Van Gorder. He is Chief Policy Officer and Vice Chair of the National Board of Directors of CARP, a new vision of aging for Canada, and the founding chair and now past chair and senior spokesperson for the CARP Nova Scotia chapter. He is the immediate past chair of the Nova Scotia Advisory Committee on Seniors Issues to the provincial government, on which he has served for the past 12 years, and he is chair of the Nova Scotia Serving Seniors Alliance Cooperative. From 1991 to 2007, Bill was the president and CEO of the Lung Association with Nova Scotia. Previously to that, he spent 20 years with the YMCA, and for the final of those years, 12 years as the Atlantic Area Director for the YMCA. Bill is a graduate of Sir Wilfrid Laurier University with a degree in political science and public administration, and he is both a certified association executive and a certified fundraising executive. Welcome, Bill.
Thank you. Good to be here.
Okay, so what we're going to do is we're going to start with Shan, and then we'll move through our other panelists. Each will have a few minutes to tell us a little bit about where they're coming from, their views on long-term care issues. I would like to introduce and welcome Shan Landry.
Thank you very much, Kathleen. And I want to say thank you to CARP for inviting me to participate. And I do know that I was second choice, that you had invited Michael Nason to present here, and at the last minute he wasn't able to attend. I hope that I'm not a poor second choice, and I'll do my best. But I wanted to start off my comments today by just sharing two very, very short vignettes that kind of give my own personal perspective about long-term care and the need for reform. And the first vignette has to do with the fact that for 4 years, my mother was a resident in a publicly funded long-term care facility here in Saskatoon, and I was the major caregiver to her as one of the only family members in Saskatoon, and I visited her regularly, almost daily. While I was involved with my mother and her care she was receiving, I came to see that the facility in which she lived was like a microcosm community. And I got very involved and got to know many of the other families and supporters of the residents there. And we participated in a family council, which is part of what the policy says has to happen in provincial long-term care facilities. And I became the chair of that council. We met monthly and talked about issues and things that we thought would make our facility a better place for people to live. After we'd been doing that for a little while, we decided that we'd like to do a little fundraising and raise the funds to assist somehow in the comfort of the residents in the facility. So we asked the administration to tell us what they might suggest that we would use our fundraising for. And the answer came back, and totally bewildered and dismayed the people who were participants in the council. We were told that they would like us to raise money for mattresses, because although this was a publicly funded facility, the health authority was giving funding that was inadequate to ensure that all of the residents were sleeping on appropriate mattresses in that facility. That is one vignette. Another vignette is a fellow that I've come to know very well through my work with different families in long-term care. His wife had early onset dementia, and he visited a different publicly funded long-term care facility in Saskatoon for 4 years every day, feeding her, caring for her, helping her mobilize, assisting the staff in every way, and communicating with her not through language but through his touch and his loving care and attention. Every day that goes by, he says to me, is the best day of the rest of his wife, the life of his wife, because we know that her condition is degenerative. And in the middle of March, he was told that he could no longer enter the facility because of the pandemic. We expected that that outbreak would be 2 weeks, and we're prepared for that. And 5 months later, he had still been unable to connect with his wife. He had tried the FaceTime, which was no use to him, and he had tried also garden visits when those became available, and they were more than upsetting to her than anything else. So he eventually applied for a transfer for her, but it was an eye-opener for us to see that family members who had played such a vital caregiving role were completely eliminated, and the risk of their visiting versus non-visiting was weighed out, and the safety of the residents defined by the facility was what guided them. So I start with those two vignettes, and for the rest of my comments, I just wanted to highlight about 5 different things that I think are elements, key elements to us doing long-term care reform in this province and in this country. And most of them have to do with grand ideas about changing our perspective. And the first one I would say is that we need to see long-term care as a part of a continuum. And this will not be a new idea, but the idea that people have choices, people have graduated options as their needs increase. And again, recognizing that not all older adults end up in nursing homes, in fact, a very small proportion, but the balancing of the system and the different places in the continuum where people can access care and support are critically important. The National Institute on Aging in September 2019, many would be familiar with it, said that they estimated about 430,000 Canadians were waiting for home care that they could not access, and another 40,000 were on waiting lists for long-term care, not because that was their choice or because that might be necessary, but because they couldn't get adequate home care. So shifting the balance that we have here in looking at alternatives for people, because one size doesn't fit all, I think changing our perspective to a continuum is essential. The second thing I think that's important is equity in access and affordability. I won't go into a long discussion about publicly funded, private, for-profit facilities, etc., but instead we'll just simply take a stand and say that as our needs increase, as people have chronic illnesses, people are living with disabilities that mean they and their families, even with home care help, cannot provide the adequate care and attention, then residential care or some form of it may be necessary, but the queuing up for those things needs to have equity, and people need to have a pathway and a navigation process that allows them to be ensured that those in greatest need are served first with the resources that we have available, not first come, first serve, and certainly not those who can afford to pay being the ones who are advantaged by having the Cadillac service. We need to have equity in our system, and we need to reform our long-term care to reflect that. Along with that would be accountability. But thirdly, I think that we need to reimagine our workforce. Lots has been said about the undervaluing of people who work in long-term care. I have a niece who 10 years ago, when she was taking her RN, told her instructors and her fellow students that she hoped to make her career in nursing in long-term care. And they actually tried to dissuade her, telling her things like, "You're a great student. Why would you choose something like long-term care, which is for people who can't quite cut it anywhere else, and the exciting rest of the system?" We need to reimagine that. We need to think that the people who are providing care to those we love, those who are most vulnerable, are people who do it with passion and are encouraged in that, and including the fact that the training and those who we recruit to work, whether it is in nursing, other health professions, or as care aides, are people who can build relationships. Kathleen, in your interview this morning on CBC, you talked a lot about that, about how part of the skill in providing care in long-term care is indeed to be able to take care of those healthcare tasks, feeding, dressing, moving people, mobilizing them, but probably at least 50%, if not more, has to do with establishing quality of life and being able to build relationships and give people the support that they need, not just to keep them alive, healthy, and fed, but to keep them functioning to the best of their ability. And our reimagined workforce are people that we should task to be able to do that by valuing them. Fourthly, I'm aware I'm running out of time, but I would say that we need to disentangle long-term care from hospital care or even health care. Somehow the frameworks that we use in our thinking lead us to believe that in a very narrow definition, healthcare is hospital care, and that's the 5-star. And when people no longer need hospital care, then they drop down in the stars to a 1-star or a 2-star, which is long-term care, which is just simply a poor man's version or a poor cousin of what we really like in our healthcare system, which is hospital care. Long-term care is not that. It is communities. It is communities of people who need to have who they are as people recognized, and we need to provide models of service that enable them to have the diversity, to live in an age-friendly community, whether it's inside the walls of a facility or outside in our community, with all the elements of what makes an age-friendly community, which is diversity, who we come to through our history, and who we are as human beings, and connected to our families. So I would say that disentangle it from the health system by talking about it more as a social service or a community service and a community development service, and we are on our way to reforming long-term care. Finally, I would say, and my 2 vignettes stress that very much, which is that we cannot look at residents of long-term care simply as individuals who need care. They are individuals who come connected to families, to friends and supporters and dear loved ones. And those people are not just visitors for the most part. They are an important part of the care team. And we need to establish that, take it for granted, and use models of care that are evidence-based, that tell us what has worked around the world to make our model of care be intergenerational, to make it connected to the neighborhood in which the facility actually exists, and to have neighborhoods within the facility that support who those individuals and their families and loved ones are a part of. So as a final conclusion, this whole presentation was labeled as "Never Put Me in a Nursing Home." And what I would say to the people who say that is, if you are afraid, if you are terrified, if you assume that the only end of your life will be that you will need long-term care, then you need to change your thinking. You need to get involved as an advocate and someone who will say, if long-term care is something that I'm going to need, maybe, I need to have done my part in making it be what I will need and suiting my needs. So if you are not an advocate, if you are not a person who likes to get involved in research and change and looking at the evidence, the very least you can do is vote and make your thoughts known to those decision makers and policymakers who will be able to ensure we have a continuum, that we have equity, that we reimagine our workforce, that we create long-term care as a community care kind of initiative, and that we also look at ensuring that we don't just look at individuals, but we look at them in their own constellation, a network of connected individuals. So thank you.
Thank you
Thank
very
you.
much.
That was
Jan.
wonderful. All right, let's move on. And Brian, I'll give you the floor now.
All right, so how do I beat that presentation? Because Sean, you spoke to so many things that are near and dear to my heart, and I didn't really expect anything less. I know a little bit about you, and certainly you've been an advocate and a promoter and a leader in this province for years, and we're blessed by you.
Thank you.
My career is a bit different in some ways, and yet very much the same. I quite by accident got involved in long-term care in 1976, and I did it absolutely by accident. It was close to home. It allowed me to play ball with my buddies. I didn't know a thing about special care homes. I had a BCom degree, and knew nothing about the healthcare system. So what I do know, though, is that since 1976, there has been a real evolution of the care that is provided in our special care homes today. They're absolutely like night and day from 76 till today. So when I started in 76, people who lived in special care homes, some of them actually chose to retire there. There were people living in the first home that I worked in that actually had their vehicle parked out in the parking lot. So think about that today in terms of today's context. So they came in, they retired, and their care needs were very minimal. And over time, their care needs progressed and often became quite heavy. So the interesting thing about this is that the average length of stay back in those days was anywhere from 15 to 18 years. They lived in a long-term care facility for a long, long time. And the interesting thing is to your point, Sean, we operated under the auspices of social services, not under the Ministry of Health. That's how old I am. So we were resourced, I think, accordingly. So that's important to note. So home care was introduced in Saskatchewan, I believe, in the early 1980s. My memory's getting a little hazy. And then it was further expanded in the initial rounds of healthcare reform in the 1990s. And so the expansion of home care services was needed then, is needed today. And this, because it's such good news, it tries to keep people in their own home for as long as possible, and sometimes forever, which is really great. But I think what happened, at least in Saskatchewan, was that we never sat back and took a look at the implications of that strategic move to improve home care, to expand home care. What did it mean for the people who were living in the special care homes then and today? And quite frankly, it's significant, because the reality is that the people who are admitted into our long-term care facilities today, their needs are often very acute, they're very complex, and they're so diverse from what they were in 1976. And there's reasons for that, which we don't have time to talk about today. And I'm explaining this evolution because maybe for the listeners, there's a lack of understanding about where we were yesterday and where we are today, and the challenges that we have today. So, and there were other factors that implicated the special care homes as well. Today, of course, people being admitted are generally much older. At Mount St. Joe, in the last 2 years, we've admitted, I believe, 4 people who were 104 years of age. 104. Okay. The other thing that's happening is as people live longer, one of the things that was not hardly in place in 1976 were people living in special care homes who had dementia, various forms of Alzheimer's and other forms. We didn't have the young people that are living in our sites today that have various neurological diseases, multiple sclerosis, Parkinson's, and the list is on and on. And I think that that change is significant in terms, again, of the resources that are required to care for these people. Because in all reality, the resource base has remained unchanged. And in the early rounds of healthcare reform, many special care homes were either closed or their resource base was slashed significantly. And I could speak to that at some length if I needed to. I think the thing that I guess attracted me to Mount St. Joseph Home a number of years ago was that it was committed to advocating for the people who lived in that home. And so my board of directors, my former board of directors, were committed to advocating for structural changes in the planning and the provision of long-term care. And I speak to the planning piece because in all reality, since at least 1976, I'm not aware of an initiative ever in our province where we sat back and tried to define, with the input of our citizens, what are the expectations of our long-term care facilities today? What should be provided to care for our people? Not only the physical needs, but to Sean's point, there are so many other needs that we need to address for the people who are living here, whether they're social needs, whether they're spiritual needs, whether it's not just taking care of someone physically that we're striving to do. So the advocacy piece by organizations like Mount St. Joseph is important, but quite frankly, the other initiative that the home undertook a number of years ago was to inform the general public of the successes and challenges of providing care in our long-term care facilities. Why is that important? It's important because without the advocacy efforts of individuals, change will never happen in our planning and delivery of care in our special care homes. It just won't, because politicians of all stripes sit back and listen very carefully to the feedback that they're getting from their constituents. And so for us, we took very seriously that notion and have worked very hard to share with the public what we're doing well and what are the things we need to be better at. And we need to understand very clearly that our society is aging, But I think, and with that goes all types of things, but I think the other big ticket item from an administrative and a leadership perspective is that expectations about what's happening in our long-term care facilities is beginning to change. And those expectations are being articulated to the special care home, and I hope they're being articulated to our elected politicians, because in the grand scheme of things, they're the people who have the power to make things happen, to change. So how do we change? How do we change? And I guess the challenge that I throw to every person that I know is you need to think about what you know and don't know about a special care home in the province of Saskatchewan, or quite frankly in Canada. What is it that you know? And then when you sit back and you think you've got that answered, ask yourself another question. If the person that you love most in the world had to live in a special care home tomorrow, what would be your expectations of that home? And I'm almost prepared to bet my life that the expectations that most of us have today, if we articulated them and we're able to put them together, we would find that very few, if any, special care home in this country can meet those expectations. And that's not to criticize the people who are working in our long-term care facilities. It's not, quite frankly. The special care homes that I know, the people who work in them, they bust their butts. They care deeply about the people that we serve. So we need to understand that, but we need to be there, to Shan's point. We need to support them as well. So when you think about things needing to change, you can sit back and ask yourself, well, why hasn't it changed already? Well, for me, it's very simple. It's one word. It's about money. Some of the changes that we're talking about require incremental resources to be provided to our special care homes. Where's it going to come from? The easy answer is to point the fingers at government and say it needs to come from them. Well, the reality is that government is another word for taxpayers. And we all need to understand that resources, even taxpayers' resources, are finite. So we need to think about that. The other obvious answer is to say, well, it's the user. The user should pay more. I don't know what the answer is, but truly this is why we are encouraging, why Mount St. Joseph has encouraged in the past, that we go through an exercise, a collaborative exercise, where we get the input of residents who are living in our long-term care facilities, where we get feedback from our families and from the general public about what their expectations are. I know from my end, it's pretty simple. I know that the people who live in our special care homes deserve the very best that we can provide, and not just physical care, holistic care. They deserve quality. They deserve an environment that is safe, where there is compassion and love and respect. And in our busy world, in our special care homes today, sometimes some of those things lapse just a bit because of the demands for the actual care, the physical care. So we need to understand that there's so many different focuses that we need to consider as we talk about what needs to change in our healthcare system. And I guess I'll throw this out. I think that the public needs to go out of its way to become more aware and become more engaged in what the issues are before long-term care providers. It's so damn easy to blame government for not acting. But quite frankly, I believe that the real accountability and responsibility for the lack of action in long-term care in this country is with us as individuals. What are we doing to know what's happening in our sites? What are we doing to support our elders and to provide them with the love and the attention and focus that they so desperately need? I think all of us need to take a real good look in the mirror and ask ourselves, what can I do to make a difference? What can I do to drive change that is so desperately needed in our special care homes today? Thank you.
Thank you very much, Brian. Lots to think about for sure. Okay, we'll move on to Bill now.
Well, thank you very much, and thank you for inviting me to take part today. And certainly, there's nothing that was said by our other two panelists that I don't agree with, and I'm not going to repeat what they've already said, except say thank you for putting it so well. What I'll try to do today is talk to you just briefly about the kind of position and resource that CARP nationally is going to be putting behind your efforts in Saskatchewan, because we all know that except for a few specific areas, the decisions around healthcare in our provinces are made in the province. So it's really up to our chapters, our members in each province to take on the responsibility for doing it in their province. And we at CARP National will do our best to give you all the background information, the support, and the guidelines we possibly can. The spread of COVID-19 in our long-term care facilities, unfortunately, was no surprise to CARP. It just has highlighted the many pre-existing and systematic issues that have been evident for too many years. In researching recently where we'd been, I went back 15 years and was still finding the kind of recommendations that if they had taken place at that time would have made a difference today. And there's no question, you know, the best time to plant a tree was 20 years ago. The second best time is today. And we have to make sure that tree gets planted today. So for CARP, the status quo is unacceptable. Long-term care in Canada, in Saskatchewan, has to be completely rebuilt from the ground up. And many people have to make that change happen. Governments especially have to understand that the day is gone when we are going to warehouse our older adults in large hospital-like facilities. You know, we're the only country in the OECD that still builds those large facilities, and the only one putting huge money behind them. It's back to the British poorhouse way of looking after people, and that has to stop now. Home and community care must be the new foundation of care for our seniors. Now, often when we talk about that, we have people get a little bit concerned because say, well, is CARP not concerned about the conditions in long-term care facilities? Oh, yes, we are, and they need to be changed very much. We need renovations, we need improvements, we need changes from multi-room facilities to single rooms or double where it's appropriate with couples. Those changes in long-term care must be made. But to make a real change in the way we treat our older adults in Canada means we have to concentrate on home care, community care, and small option care. So what CARP is going to be doing nationally in support of what you're specifically doing in Saskatchewan is we're going to be not with all the other voices that from many organizations that are concentrating on the improvements of long-term care, although we certainly support those. We're going to try to be the additional voice talking about home, community, and special needs care. This is a continuum. Long-term care, as Sharon mentioned, that long-term care of our older adults as they get older is a continuum. It's not just too many people equal long-term care facilities with everything there is about long-term care. Long-term care is a continuum, and we have to start with people who are at the beginning of that continuum through until the end of the continuum. So we're urging governments to recognize that home care and community care solutions are critical in resolving the whole long-term care crisis. We know that to keep our vulnerable citizens safe to begin with, there's no place like home. We did a survey a little while ago. 9 out of 10 CARP members said, yes, they want to age in place. They may need some health support, but they should be able to get that in their own home, in their community, before they have to go into a long-term care facility. Canada spends significantly less of its long-term care spending on home and community care versus nursing care than other countries. The average of the other OECD countries spend 65% on residential care and 35% on home and community care. In Canada, we spend almost 90% on long-term care and only about 10% on home and community care. And that has to change. So nationally, what we've been calling for from the federal government is increased support for frontline home care, respite care, and day programs, increased funding and use of technology-enabled home care solutions so that individuals can live safely and independently, expanding telehealth care solutions, and ensuring that all caregivers have access to the financial relief that they need through the federal family caregiver tax credit. A tax credit, if you're not working, if you have to stay home and look after your older relatives and you're not making any money and you're not paying taxes, a tax credit is worth nothing to you. That should be a refundable or a rebated amount. We really need a new cycle to fight against COVID-19. The battle certainly isn't over, and we've seen in some provinces it's getting worse, horribly worse, just in the last few days. But in order to protect older adults in our long-term care facilities, we have to improve, augment, and strengthen the home care and community care services, and that's what we'll be working on. So we'll be supplying the provinces, the local CARP members, the chapters with as much information and help as we can in terms of the advocacy portion. Many of you have seen the advocacy package that we have for our chapters now, and the CARP members across the province watching now need to know that your leaders have the kind of support that they need available now, and more will come for you. Our job is to make sure that you get that support that you need. The other thing that we'll be pushing for, and this was mentioned earlier, no question, is that we have to involve the older adults who are in long-term care, who are using home care and community care and small option care. We have to involve them in the discussion. Discuss with us, not about us. And that's been one of the biggest problems in the whole last 6 months of COVID, is governments and facilities and others have been making decisions for older adults and not discussing with them what they want and what would be best for them. And we need to keep that in front of people all the time. Our 320,000 CARP members across the country vote. We need to put that voting punch behind this advocacy program and make sure that governments at all levels know that older adults across the country want change. They're going to have change, and if they don't get it, they're going to vote for somebody else who will give them change. So that's the kind of program we'll be putting in front of you. That's all the time I want to take now, because I want to hear what the other panelists and the viewers, so what their opinions is. What else should we do to get success in this area?
Thank you very much, Bill. Okay, what I'm going to do is I'm going to turn it back over to Kathy now, and Kathy is going to moderate our question and answer period here. Kathy?
Thank you very much. Just to summarize, what I heard there was Shan talking about her personal experience, which is just so valuable, and looking for graduated options, and a real belief that family involvement should be more valued. And Brian, I think it's amazing that someone can talk about the evolution since 1976. Thank you to be able to capture that as a background and how you've seen not the system change, but people change. There are longer lifespans. And so now we have the issue of dementia and Alzheimer's becoming more common. And then Bill moved on, really picked up from what Brian said. Brian said the politicians aren't going to do this. We've got to start making a fuss. And Bill talked about the status quo being unacceptable, and that 9 out of 10 people said they would rather age in place. And so we need a new vision of aging, and people need to be listened to. So I have some great questions that we came up with earlier and also popped up on the Q&A, but there's two main threads, and one is what can be done to keep people in their homes longer, and what can be done to improve long-term care facilities. But none of this is a criticism of the carers, because we do know that many of them are very, very, very dedicated. They work, much harder than they're paid to do. So first question is for Bill. If we're looking for a more compassionate and a kinder care model, is that going to be more expensive? So as an example, you talked about some international examples. How does Denmark support and afford its focus of services on aging at home versus Canada's warehousing of older adults that you mentioned?
Well, they have made the investment that we have need to make, and they need to make that change. One of the things we know is actually delivering home and community care and small option care is actually cheaper than having people institutionalized in large buildings. But one of the problems always with that, even though there's all kinds of good research and evidence to show that it would actually cost less, it's very difficult to get governments to move in that area and people to move in that area, because it's money saved in one silo is not automatically spent in the other silo. So it takes people at the very top of the decision-making process to say this must happen, make it happen. It's not something that's going to happen by itself.
So if I can ask Shan a question, if we're talking about home care solutions, what services do you feel are currently lacking in Saskatchewan home care services at the moment, and what would support individuals to stay home and be independent for longer?
Well, I think my answer might surprise a lot of people, but what I would say is that it is not so much the acute end of things and the delivery of nursing care and things along those lines, although we need more of it. I would say that what's missing is what we used to have years ago, which is the preventative things, the things that in fact, as people start to be unable to manage their own homes, they need input and support for. So housekeeping, maintaining their house, being able to ensure that they get groceries delivered, all of those things that set the stage for us being able to stay longer in place if we have other people to draw on us. And that is not to separate it from all of those other kinds of acute things. Occupational therapy, physiotherapy, those kinds of health professionals as well, particularly occupational therapy, which would help us recognize that there are different ways to do things if we are unable to do them the way we used to. And getting that kind of an orientation built into our home care, I think, is essential. So having a scale from prevention to early intervention to intensive replacement kinds of services for other more sophisticated healthcare are the whole continuum of home care I think we need.
Thank you. So Brian, if we could just talk about your experience at Mont St. Joseph, could you tell us a little bit about how that differs to the more traditional facilities, so for the residents, but also for the support staff?
I'm sorry, I missed the question.
With your experience of Mont St. Joseph, could you tell us how it differs from the more traditional facilities, perhaps for the residents, but also for the support staff, for the people working there?
Well, you know, I don't know. Number one is Mont St. Joe is an affiliate agency that is outside of the jurisdiction of the SHA. stating that. We work very closely with the SHA in a whole number of different areas. But that independence allows us to do some things just a bit differently. So from a functional perspective, I believe that one of the things that we did a long time ago was become an Eden. We adopted the Eden alternative as a philosophy of care that we committed ourselves to. And to Sean's point, one of the things that I believe is a strong contributor to people eventually being institutionalized is the plague that Eden talks about, the plague of loneliness. And so, you know, if people are at home and they're by themselves or they're very, very isolated, all of a sudden there's a whole bunch of things that happen that discourage people from thinking about tomorrow and thinking about it with hope. So what we tried to do with the Eden Alternative was to speak to the issues of loneliness and helplessness and boredom. And there's a whole bunch of things that all kinds of facilities do, all types of long-term care facilities do, but we put a real focus on getting the community engaged in what it is that we do, and getting our people engaged, our residents engaged with the community at large. We put a whole bunch of focus on doing things just, I guess, a bit differently. We're also faith sponsored. The Prince Albert Roman Catholic Diocese is our sponsor. So we put some focus on the spiritual side of things that potentially some other sites don't do as well. And I shouldn't say as well that they're not resourced or supported for. We're blessed with a foundation who supports our spiritual care initiative, blessed with a foundation that supports staff education. If our funding, we have no support for education. Me.
Okay. I'm sorry, someone please mute your lines, please, so that Brian can continue.
Okay, so good. That wasn't me. I was hoping it wasn't me. So we've tried to create a culture of learning and a culture of spirituality and a culture of community that is always focused on our mission, that talks about the opportunity to give care and to receive care for our elders. So the reality is if the person who's living in a long-term care facility, if the only thing that they're doing is receiving care, they sit back and they miss on one of the most important things that we all recognize, and that's the importance of giving. And so it's like Christmas time. Do we think about the gifts we receive as much as the gifts that we give to others that make a difference for them? And so those are the little things that we do. Are we better than anyone else? No, we're not. We just approach things quietly, just a bit differently than possibly some others. And I guess for me, it's the advocacy piece. My former board of directors made a real effort to advocate, not only on behalf of the people who lived at Mount St. Joseph Home, but to advocate for change right across the system, because all the things that our panelists have spoken to, we need to look at them. And we don't need to look at them tomorrow. We need to look at them today. We have to change the way we're doing our business. We have to change our approach. We have to change the way we think about long-term care in this country.
Thank you. So that philosophy was called the Eden Alternative?
That's correct.
Yeah. So if I can go back to Shan, with your experience of dealing with family in these facilities, was there, or if there wasn't, do you think that there should be a client resident advocate in each residence?
That's an interesting question. I'm not sure that a specific role like an advocate would be what I would recommend. I think my background is in social work, but I think that if we were to recognize that social work is an important component. Every family brings to the facility all of the issues and dynamics that they've lived with for the whole life of the resident themselves. And so recognizing that we're not all the same and having a facility that has individuals who can pay attention to that would be important. I think one other thing, and this is sparked for me as I heard the other panelists talk, is that I absolutely agree in aging in place, and think that we have to do everything we can to ensure there's adequate home care and a whole continuum of assisted and supported living for people as their needs change. But I think that we must also be cognizant of the fact that too much stress on people remaining always in their own homes for the entirety of their lives isn't necessarily workable for everyone. And many families that I encounter in long-term care carry a great deal of guilt about the fact that they were unable to provide what was needed to their loved one and had to resort to something that others may think was an abdication of their responsibility. And so we need to understand that even during COVID, when some of the recommendations going out there to families where, if I were you, as quickly as possible, I'd go and get my loved one out of long-term care. And families looked at one another and said, do you think they'd be in there in the first place if I could look after them at home? That's not the case. And so someone, social work or an advocate or a family engagement specialist, might be able to help work on some of those attitudes and approaches that mean accessing the continuum is what will enable aging in the right place, as opposed to simply saying that the only place is home. And it touches on what Brian said too about loneliness and the factors of people. You know, I'm not sure that as I live alone now, I want to live alone here forever, because what I can see in assisted living and other kinds of communal living organizations is where some things are brought to you, some activity with others and seeing others' perspectives and making friends is essential to my thriving and my quality of life. So I think we have to broaden our definitions and expectations about how family engagement, as well as our own engagement in the world around us, can be enabled best. And that means having certain choices. If I can I just squeeze in one other thing that was provoked by something that Bill and both Bill and Brian have touched on, and that is the whole idea of people in long-term care having human rights. I think, as Bill made the point, what we've seen over the last 6 months is the fact that somehow the system seems to believe that once people are admitted to long-term care, the system owns them and that they do not have a right to make choices. And many older adults that we've spoken to in the different groups I belong to over the last 6 months have said, someone should ask me about the risks involved and being able to maintain my own safety, whether or not I am prepared to sacrifice seeing my grandchildren, perhaps ever again, or dying earlier from COVID because I took the risk. Absolutely, in long-term care facilities, we have to keep everyone safe, but at what expense and what input do people get in saying what choices they have about weighing out those risks for themselves? I hasten to suggest that many people living in long-term care now would not make the choice that is being made for them about being so isolated just so they can live. Is that quality of life? I'm not so absolutely sure. I get to choose when they tell me to wear a mask, follow public health rules and regulations to keep myself and others safe. I make those choices and I do so knowingly. Why do I think that people who live in long-term care cannot or should not be able to make those choices themselves and with their family decision makers? Thanks. Get off my soapbox now.
Thank you very much.
Well said.
I think that hits home with all of us. You know, many people have had, we're not in that situation, but we have got family who are. So I will squeeze in just one last question because it's such an important one. And I'll start by asking it to Bill, but then leave it open if the others would like to answer. So Bill, how do we change whistleblowers fearing or facing reprisals against loved ones or themselves if they make a complaint against a facility or a care worker?
Yeah, that's a really good question and a really tough one to answer, because often families and residents themselves are afraid to raise issues because they're afraid that that will be held against them. And it's not the only area of life for older adults we see that kind of thing happening. It often happens in terms of people scammed or defrauded, where they will not report the person who did it because the person is a caregiver, somebody that they trust and work on. Part of that, though, is education for the employees and the management of our facilities in all areas. One of the problems we have across the country, and I think Brian will agree with this, is not all management in long-term care are as trained or as involved in the community as Brian obviously was with his. We need higher standards of management. We need higher standards of culture within the organizations, and that can only happen within time. And there has been, one of the things that we can do is make sure that all the facilities have active resident councils of some kind, maybe not an advocate, but a council. So as a group, they can point out things that makes it much easier than for one family or one individual to do it. It's another of those problems that the culture has to change before we solve it in the long run.
Thank you. So I don't know if Brian's got anything to add to that.
Well, certainly, I mean, it's a great question. Certainly on our end is we encourage our staff to be advocates because the reality is in too many cases where residents no longer have family or loved ones or close neighbors that can support them, who is their support? It's the people who work in our long-term care facilities and our special care homes. So I believe that advocacy needs to happen at that level. The other piece, that the most critical piece in my view, is for those elders who are lucky enough or fortunate enough to have family. We work very hard to encourage residents' families to be advocates. And if they have questions or concerns about the care services that are being provided, we encourage them to speak to those issues today, not 6 months from now, not down at the local co-op grocery store, but with our staff, so that we can fix them and make them better, I guess is the better word. I'm a farmer, so. But the reality is the longer, if there is an issue, if we're not doing something right, you can almost bet your life it's not because we're doing it on purpose. We're making a mistake, and we want to be better tomorrow. We all dream in our work, whatever it is, that we can be better tomorrow than we are today at what we do. And ultimately, you cannot do that if you don't have a good exchange of information, if you don't have advocates. And I'd like to say that really that advocacy piece stretches then to government as well. We all have a responsibility as individuals and as health organizations who provide long-term care to be advocates, not to be critical, because I believe that what we did yesterday, people did their best to make it work. But we know today that things need to change. So rather than being too critical, we're going to sit back and offer very constructive criticism and suggestions that will lead us forward to a better model, a better way of taking care of business, taking care of the people who built this country, a better way of loving them. And so all of us need to have that advocacy piece. Do we need a specific advocacy professional in our long-term care facilities? I don't know that we do if we take the approach that we've taken at Mount St. Joe, recognizing that recently, at least in this province, and Bill, you could maybe speak to this, a number of years ago, 4 or 5 years ago, I don't remember when, government moved to have the Ombudsman's office involved in complaints that were raised by the public about, let's pretend, Mount St. Joseph. And I believe that was a real step forward in terms of dealing with not only the issues that are happening in a long-term care facility, but the issues that are happening across the spectrum of care in our province. So I saw that as a very positive step forward, and I just hope we can have more of those examples to share the next time we meet.
So, Shan, I don't know if there's anything you wanted to add to that point about whistleblowers fearing or facing reprisals.
I think I would just echo what Bill and Brian have said, which is that we have right now perhaps a paucity of leadership. The kind of leadership that Brian is describing, the kind of leadership that comes from people understanding that our motivation is not to make money, our motivation isn't to warehouse long-term care residents. Our motivation is to provide care and to do so in a loving and respectful manner. And we can do that if we build our communities on that, whether that community is a long-term care facility or the neighborhood in which my house is located and I live in Saskatoon. Caring for one another is absolutely important, and we need leadership to foster it.
So I think at this point, what I'll do is say thank you very much to Shan, Brian and Bill for all your input. And thank you to everyone who jumped on the call. There's really good questions in the Q&A and the chat. What's pleasant to see is it's not just Regina. We've got people from as far away as Manitou Beach and Nipawin. And there's carers I can see asking questions. There's also some RNs. So there's some people who are in the healthcare system who have joined us. So I think for now, what I'll do is hand over to Kathleen to wrap up.
Thank you, Kathy. Okay, so this has been so phenomenal, having this kind of information, having this discussion. I hope that you take away some really good information and share it with people. On October 5th, our third and final town hall will include a discussion on the need for fully funded best-in-class vaccines for seniors in Saskatchewan, specifically the more effective high-dose flu, shingles, and pneumonia vaccines, which are currently not funded by SaskHealth and therefore cost you out of pocket when you buy them. The next time someone from a political party calls or knocks on your door, ask if his or her party is prepared to legislate an independent seniors advocate for us, and how soon after being elected. We're linking arms with seniors associations around the province, and we're saying these are concerns that we have. We're worried about long-term care. We're worried about not having a seniors advocate, a one-stop shop for independent review of things that happen and concern our seniors. And we're heading to the polls on October 26th, so this is a good time to speak up. And finally, if you're passionate about seniors issues, like to share your talent and energy and better our community, and are looking for some camaraderie and fun, we invite you to join us. It does not matter where in Saskatchewan you live. If you're open to doing virtual meetings, then come on board. For more information, our email is carp@regina.ca. I want to thank everyone for joining us, especially our panelists today. Have a wonderful week. Be well, be happy, and please stay safe.
Take care, everyone.
Thank you. Take care.